You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this space every week. Super excited about today's interesting conversation. Ivan, go ahead and get us started.
Yeah, I'm Evan Zach. I'm excited on two fronts. One is that we have very interesting guests. Another one that this is my second conversation about artificial intelligence with Sean on the podcast today, and he couldn't hold himself quiet between the conversations. So we'll see how he'll do in this one. But our guest today is a colleague of mine, Dr. Ryan King. Dr. Ryan King is an ACVR board-certified clinical radiologist who taught at Tufts Cummings School of Veterinary Medicine from 2002 to 2020. Tufts Vets has been a satellite practice of Tufts since 2006. Dr. King has been the ACVR exam committee member for 6 years and the current ACVR president, working part-time for VetCT since 2018. Ryan, welcome to the show. Thank you for finding the time.
Thanks for having me.
So our conversation kind of started with the episode with Neil Shaw, the founder of SignalPet, and he was interested to have someone from the college to join and to discuss topics that we're about to touch on today. We're not necessarily going to dive directly into those sort of back and forth because we want to have all the parties on the same podcast or the webinar to discuss these. But what would be interesting is to just discuss sort of where we at with artificial intelligence in the radiology world, where we are with radiologists as it is. Do we have enough of them? And what's your opinion? Are we getting in the right direction by implementing AI in the radiology world? So I'll open up with that, and you can pick any of those three kind of questions to begin with, and we'll roll with it.
Yeah, I think those are all excellent questions and great places to start. I think that the realism is that there probably aren't enough veterinary radiologists in the community at this point. And we are working behind the scenes to see if we can try to improve things on that front, but it is a slow-going process. As more and more radiologists leave academia and move into private practice and or teleradiology, there are fewer people to teach and then fewer residencies, and that's how we get new radiologists out into the community. Regarding AI, I think much to possibly the surprise of Neil, I am certainly a proponent of AI, and I think that it's going to change not only veterinary radiology, but the veterinary industry as a whole. And I think, I'm really looking forward to some of the improvements that it can make, particularly in the realm of efficiency and patient care.
Awesome. So, Ryan, I'll take it back to 2017. Me and Ivan had just met each other. We were still friends at this point because we had known each other for a week or two. And we decided we'd go to San Francisco to Google I/O. And we went to this radiology forum. We're talking 27 now, or 2017 now. And it was the CIO for the hospital system in Tokyo, director of technology and innovation and radiology from the country of Brazil, overlooking all of their hospitals, and Italy, and a few others. And much to our surprise, back in 2017, we found that every radiology in some of those countries was read by an AI or image recognition, and then prioritized to go to their limited set of human radiologists at the time. And so that was many, many years ago, many iterations of technology ago. And so, in your opinion, having that as a backdrop, where is veterinary radiology going and what does the future look like? And then maybe what are some of your concerns about how we get there?
Sure. So I think veterinary radiology is nuanced and it is unique compared to human radiology. So typically in human radiology, at least in North America, every image is read by a radiologist at some point, even those that go through AI. That's not necessarily true in other parts of the world, but it certainly is true in North America and it's certainly true in much of Europe. Veterinary radiology is unique because there are general practitioners that are interpreting a lot of images on their own, and which is how it should be. They're certainly trained how to do that in vet school, just as a human physician is trained how to interpret an image in med school. But in the human realm, all of those images go on to be interpreted by a radiologist. And we're starting to move to that in veterinary radiology. When I started a number of years ago, many of the veterinary radiologists were in academia. There weren't that many that were in private practice, and there weren't that many doing teleradiology, if any. And now we've come to a point where the vast majority of veterinary radiologists are in teleradiology and private practice, and there are very, very few left in academia. And I think that that's become a bit of a problem because as we are shifting more and more of our cases to being read by radiologists, which is, I think, a good thing, we are limited in the number of cases that radiologists can possibly read. And of course, as more and more radiologists are drawn out of academia, we're limited in the number of radiologists that we can train. Our primary site of training is still in academia, although there are a number of private practices that are offering residency programs at this time as well. And so I think that it's unique. There are still a number of private practices in veterinary medicine that are not sending all of their images or are sending a portion of their images to radiologists. And then there are others that are moved to sending almost all of their images to radiologists.
So the question is on, I guess, the artificial intelligence and how it progresses. And I think that the question that kind of bubbles up to the surface, how is it trained? I think that is one of the important things. And I was just driving yesterday for about 3 hours, and I was listening this podcast. It was called "The Stolen AI," I think it's called. It's quite a popular one, and they talk about how the mass data is trained right now. Like the Mechanical Turk, I think, is the company of the Amazon that hires these mass people and outsources image recognition. How Google shows, click on every image with the traffic light or the motorcycle on it. That's we're training their AI based on that. And then the question is, do you know, or do we think that most companies that are on the market today, they're actually going, because recognizing motorcycle is probably could be outsourced to someone in a third world country and still make them happy and all of that. But do we trust someone in recognizing the cardiac enlargement or the splenic size and location or foreign body and those things? So are we going through the same pattern recognition to then train the neural networks, or are we not? And that is a concern for the radiology.
I think it is a concern. I think you bring up a really good point. I think it is challenging to know the answer to that because there isn't a great deal of transparency in the market currently. And so we don't necessarily know what data set has been used. We don't know what data set has been used for testing. And we don't always know what the ground truth on those cases is. And so Steve Jocelyn and Kate Alexander looked a couple of years back at what would it take to really make a good model, what mechanisms can we use to evaluate AI algorithms for use in veterinary diagnostic imaging? And they walk through all of these things, looking at the importance of good quality data from the outset, looking at a test data set that is reliable and consistent, looking at ground truth. Who is it that's actually determining what the actual answer is on these cases? Who is determining, yes, this has pulmonary edema. No, it doesn't have pulmonary edema. Now the machine needs to learn how to interpret that. And so it's a real challenge because none of that is particularly transparent. A lot of that is tied up within the players in the industry, and we don't necessarily know how those are developed, and we don't know how they perform. And I think that that's a real challenge. I think that one of the things that's unique about, again, similar to what we talked about a few minutes ago with veterinary radiology, is the lack of regulations compared to human radiology, right? So any AI system in human radiology has to go through a significant amount of testing, a significant amount of peer-reviewed testing and peer-reviewed publication. It gets submitted to the FDA. The FDA makes their own evaluation. It gets submitted to two other industries to do further evaluation on it, and then has to meet a number of thresholds before it can be released to the general public. And there are just no regulations like that in veterinary radiology.
Yeah, it's such an interesting situation, and it makes me think of scooters in San Diego, Uber taxis in Toronto, and the lag for these governing bodies to catch up to the reality that's happening on the street. And so, what does that look like? Is there a movement afoot? Is it going to happen? Does anybody care enough to make sure that it does happen? Do you have any insight on that?
Yeah, I mean, I think that is challenging. I think that it was one of you who said not that long ago that the industry is outpacing the regulation, right? So it's going to be a challenge to catch up, and there will be some reticence for industry players to look towards that regulation with a positive attitude, I think. Currently, there are no real guardrails in place to protect the general public from a commercially available product, AI product, interpreting images. There are the general public, the general practitioner, the pet owner doesn't necessarily know what went into that product, how well that product performs specifically for their pet. Do they have a French bulldog? Do they have a Great Dane? Do they have a cat? And what is the disease process that they're looking for? And we're starting to see some changes in that regard. We're starting to see some publications in the ACVR journal, the Journal of Veterinary Radiology and Ultrasound. We've seen 2 or 3 publications lately, particularly around thoracic imaging. So we've seen the ability of AI to detect pulmonary nodules. We've seen the ability of AI to detect pleural effusion. We've seen the ability of AI to detect cardiogenic pulmonary edema. So we're starting to see that peer-reviewed publication, which I think is really what we need to strive for, so that we are assured that the products are able to improve clinical outcomes and or improve patient care. I think it's going to be a long road ahead. I think that when you look at those studies, they all take a long time to do. They are very unique and very specific to the disease process that they're testing. And you can imagine that, I just listed 3 of probably hundreds of different things that we would need to test just in dogs. Then we need to do the same thing in cats. Then we need to do the same thing in our equine patients and so on. And so it's a long road ahead, but I think that we need to start somewhere. The ACVR is working currently, Dr. Ryan Appleby is working on, with his committee, the AI committee, on putting together a position statement that the ACVR is going to put forward, so that we'll have something to turn to that will give us some of those guidelines and some of those best practices as we move forward.
So, and I'll just sort of kind of throwing a couple curveballs at you here continuously. I agree with the lack of regulations in the veterinary industry compared to the human, but back in the SmartFlow days when I developed product, that was the beauty of it. So I created a treatment sheet on the iPad, and that was the beauty that we built something in my condo with my buddy, and then we rolled it out 3 weeks later. And then whether good or bad, I'm not going to even judge it. For us it was good because it was startup bootstrap. We rolled it out. And then, but you look at many startups, we had over 250 startups here. None of them needed that regulation. And in fact, it almost like quite a few startups looked at the fact that you can start something in veterinary medicine, almost like test it out, and then gradually mature to the human medicine and then go through FDA, but you have the test case created. So to me, it's sort of the good and the bad of that lack of regulations. And I guess it just gets to the point, where is it dangerous not to have them? And I certainly agree with the X-rays, because there's some startups on the market. We tried one with the AI interpretation, and we were looking whether it was foreign body or not. And the answer was there's a broken rib, which was not there. So I was like, that was useless. So where's that fine line? And then I guess the question that I'm trying to formulate here, is there a collaborative approach where someone with the specific degree and education and the entire board that can actually insert themselves in collaborative way and say, hey guys, we see the advantage in here of this, but how do we create the guardrails so there's at least some sort of standard so we push out the products? Do you see that collaboration happening with the startups and the board in the radiology world? Is there a conversation going, or is there just a pushback and be like, well, we're having a regulation, so we don't care? Like, what does that look like right now?
Right. I think you've raised, some excellent points. And so I'll try to tackle them, and you may need to remind me as we go along of each of the points. But I think that when a product is going to directly affect a patient, then I think that there needs to at least be some standards, some metrics, some regulation that would say that that product is effective and is not harmful. And so I think that if you're developing a medical record system, you are probably at low risk of affecting a specific patient. If you're developing a dictation software, you're probably at low risk of affecting a specific patient. But when you start to interpret x-rays and interpret whole body images of patients, you have the risk of misdiagnosis and of pet owners and the general public and general practitioners acting on those interpretations in a way that could be harmful to the pet. I can point to a similar situation to what you just brought up, but a case that came to me on a teleradiology situation where the patient had been images have been interpreted by AI as having a pulmonary mass. And when I looked at the images, I did not see any pulmonary mass at all. The patient went on to get a CT in a specialty center and was set up for aspirates and biopsies of pulmonary mass based on AI. And so I think that there are risks associated with it, and the risks are real, and we need to have some guardrails in place. And so then to the second part of that question is, where do we start with that? Who is it that's going to take charge of that? And I don't know that we've got a definitive answer at this point. The ACVR's mandate is, predominantly in education and training, although we also try to, protect the general public by, making sure that we're ensuring the competence of our colleagues and of the college and so on. But it isn't necessarily to endorse or promote a specific product or service. So we run the risk of saying, this product is acceptable and this product is not, without necessarily guidelines or a mandate to do that. And so I think that we can play a role, but I think that there are going to need to be a number of players. I think that we're going to need to have players probably from the AVMA. I think we're going to need to have players from ACVR and ECVDI. I think we're going to need to have radiologists who can provide either that ground truth or that background knowledge to be able to evaluate the images. I think we're going to be able to, or we need to have general practitioners involved. We get the end user and we make sure that we are capturing their concerns and get some feedback from that level as well. We don't have anything started at this point other than a lot of discussions. And so we've had, the panel last year at our New Orleans meeting, ACVR New Orleans meeting, where we had a number of industry players on a panel that we could ask questions and had a great back and forth conversation. We've been invited to Innovation Summit at AVMA in 2 weeks. And I hope to be able to attend that so that we can give some feedback from the radiology perspective on things like that. But we are in the early days, realistically, of trying to get a handle on this. I am not a denier that the technology has outpaced our ability to put up those guardrails. It's very easy for a company in 2024 to start up and say, hey, we've got an AI algorithm. We're going to put it out there to the general public. We're going to market it to the general public. We're going to market it to general practitioners. And we're going to say, this is your new digital radiologist. And it's very hard to get it out in front of that at this stage.
Yeah, it's super fascinating. And it's so hard to know where to go with the conversation, but let's make it a little spicier. I think is probably the best way to go at this point. I think a lot of people that are listening to this episode and a lot of people in industry are probably thinking to themselves, veterinary radiologist is one of the most highly trained specialties in veterinary medicine, and therefore one of the highest paid specialties as well. And so I think there's a natural inclination outside of this conversation to say, of course, they're opposed to AI because they want to hold on to what they have. And so how would you address that situation or that question? Because I think that's the elephant in the room. I think that a lot of people from the radiology community are perceived to have that perception. Like we don't want anything to change because we like it exactly the way it is.
Sure. I think that that's fair. I think it's somewhat misplaced. I think that if you were to poll many of my colleagues, if not the vast majority of my colleagues, I think you'd find out that many of them are ready to embrace AI. I think that the challenge that we have run into is the results of AI that we are commonly seeing as veterinary radiologists, our interpretation of whole abdomens or thoraxes. And quite often we're seeing the second opinion on those cases. And so we're quite often seeing the errors, or we're seeing the concerns that have been brought forward. But to take it back a step, I think that if we had AI that is similar in function to what's available in the human spectrum, I think we would embrace it wholeheartedly. If I could get AI that could start a report for me, that could increase my efficiency by making sure that radiographs are hung correctly so that the head is on the left every single time or the head is up every single time. We're not even at that stage yet. And then to move from there, if I could get a piece of software that I knew was consistent and effective in detecting pulmonary nodules, I would run every single thorax through that before I even looked at it. And then I might be able to use that as a triage system. I might be able to use that to prioritize which cases I might get to first. It's not to say I'm not going to get to all the cases, but it's to say I might be able to get feedback to my oncologist down the hall a little bit earlier on a case that might have a risk of a pulmonary nodule. And so it's those areas that I think that radiologists are really, truly excited about AI. We're looking at our human colleagues, our human radiologist colleagues, and they've got some great AI tools that they're using to increase efficiency in mammography and pulmonary nodule detection and stroke detection. And we're not there. Our industry is such that the current players, many of the current players in the industry, have gone out for what I would consider to be a bit of the low-hanging fruit. It's really easy to come out and market a system and say, hey, we can be your digital radiologist, and we're going to, all comers, bring your radiographs to us and we'll interpret everything. And the data just isn't there to support that is an accurate statement at this point. I wouldn't be surprised if we get there. And I wouldn't be surprised if we get to a situation where we can validate those commercially available AI products to the point where we are comfortable with what they are putting out as an end product. But I don't think that we're quite there yet. But I don't think that will stop radiologists in the industry from embracing other components of AI and trying to incorporate them in our workflow.
We're getting close to the end. This episode is so short, and we could have this conversation expanded, definitely. But maybe a very short question, in your opinion and conclusion. They're talking about this new sort of technology revolution, that the industrialization took away a lot of blue collar jobs. And right now they're talking that this is a white collar job, a kind of threat. Do you, not as the college that you may, someone can see you represent, but you as a human, do you think there's a possibility that radiologist as the specialty could at some point be eliminated with AI?
I don't believe that that's going to be the case. At least that's not going to be the case for a number of years. There's been statements that, if you don't adopt AI, that you're going to be left behind. And I think that I can get behind the statement that a radiologist using AI is going to replace a radiologist that's not using AI. I think that's a fairly commonly heard statement in the industry, and I can easily get behind that. I don't see it replacing radiologists at this stage. It certainly isn't going to replace them in the human realm, because there are guardrails in place to ensure that all of those studies that are being read by AI are also read by a radiologist and are being overseen by a radiologist. Again, we don't have those guardrails in place, so is our job more at risk than a human radiologist job? There's the potential for that, but I don't see it happening for a considerable amount of time.
That's awesome. Well, I appreciate you coming forward with this conversation and handling the spicy questions. And we are at our usual mark where we promise the bite-sized episodes. There's 2 questions that we ask at the end of every episode. And the first one is there a TED Talk? Is there a YouTube video or book or anything else that inspired you recently that you would recommend to our listeners?
Yeah, sure. I'm going to cheat and give 2, because one, I want to put in a plug for the special issue that Veterinary Radiology and Ultrasound put out in 2022. It's a free issue. It's open source and available to everybody. And the entire issue is dedicated to AI. So if people want to learn more about AI and about what ACVR's role in AI is, then I would strongly recommend that they have a look at that. The book that's on my nightstand, and I have to be honest and say that I haven't managed to get through the entire thing, there's some definitely heavy reading, is a book called Seeing Further, and it's the story of science, discovery, and genius of the Royal Society, and it's by an author that I've followed for a long time. He's actually a travel writer, but has sort of moved into the realm of science writing. His name's Bill Bryson, and he curates a number of writings by different scientists, and I just find it absolutely a fascinating book. So if you get an opportunity, then that would be one to look for.
Awesome. And then the last question is another innovator that you think we should have on the podcast.
Yeah, so the 3 of us have had a little bit of a conversation about the potential of a future discussion. And so I would, again, break the mold on this one. And I think I would make a recommendation that instead of having a 20-minute podcast, I'd like to see us have a bit of a forum, maybe a 1-hour special episode or something like that, with the players in AI in the veterinary industry. And right from the commercial vendors through ACVR/ECVDI to some end users, I think that would be an absolutely fascinating podcast or forum to listen to. So I think that would be my recommendation.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.